Hello everyone. It's really good to be able to do these lessons over Loom. I hope that you are enjoying them. Some of you have indicated that they are good to have. I'm not trying to rush through things because it's really important that we just kind of keep things going, keep things ticking, and just kind of keep as up to date as possible. Also, a number of you have asked about the workbook, and I've now put a copy of the workbook onto the Google Classroom, and you're welcome to use that. However, I thought as we return, we could then figure out what exactly we need. So I can either bind the notes that you already have, I can create a new book, I can do something along those lines. But for now, what I am doing is putting the kind of set of notes up there for you to have a look at, and these particular notes as well, so you can annotate them as best as you can. Now, in the previous video, we looked at risk factors, and we're going to continue that to possibly one of the more important risk factors besides biology, and that's stress. And we see here that everyday stress is generally associated with relieving anxiety. Now, the reason I mention that straight away is this idea that, well, what you're going to do about relieving anxiety, and so therefore it's your addictive substances, it's alcohol, it's recreational drugs, it's things like that. It also could be associated with addictive behaviors, and certainly you might have found during this particular time that you've turned to your electronic devices to kind of help you get through some of the things that you have found difficult. So, as a risk factor, it says here that stress or everyday stress is a risk factor. Just a reminder of the concept of risk factors. It's saying if you have stress, it means that you're more likely to engage in an addictive behavior. It doesn't mean you will definitely engage in addictive behavior. It means that you're more likely. Because it's more likely, it means that it puts you at risk. Now, this is just related to the previous kind of comment about everyday stress, and people say that they resort to drink, smoke, and other forms of kind of easy to acquire kind of drugs as a means, and uses the word here coping. Now, I suppose many of us are quite conditioned into this, doing something that kind of makes us feel better. Certainly, if I've had a tough day, I like to have a cup of coffee and a piece of cake. Okay, now of course, if this becomes habit forming, we then go back to your tolerance and your dependence ideas, and then it becomes, reinforcing in themselves. I need more coffee, more cake. Now, of course, some substances seem to be able to affect me in different ways, and certainly alcohol and drugs can certainly affect me in certain ways. The other type of stress that they talk about is traumatic stress, and this is really possibly the saddest part of things, because if you read some of the books that I have read, you see that actually some kind of trauma is often associated with addiction. Okay, and so it says here, severe stress makes somebody more vulnerable. Now, what is important here is the use of the word vulnerable. It goes hand in hand with risk factors. You are vulnerable if you've had severe stress. Okay, so therefore that vulnerability means that you're more at risk. And it does say here that children who have experienced something like parental loss or child abuse may well be more vulnerable towards traumatic stress and obviously then addiction. Just a bit of evidence to kind of point towards what we're saying here. Anderson and Teicher basically said that if the severe stress is during a sensitive period, of course, that particular kind of problem or the stress that you are experiencing may actually have some developmental issues. Okay, so for example, your brain actually might be changing. I know that when you reach puberty, that your brain is sort of getting rid of all the synapses. It doesn't. One is called synaptic pruning, and it's developing its prefrontal cortex, that part of the brain that helps you kind of be able to delay gratification. Now, of course, to couple that with addiction and some of the addictive substances, if the actual part of my brain that is developing delayed gratification and helping me think sensibly about things is being affected by a drug, it becomes problematic. And you often find that young people who kind of smoke cannabis from age 12, 13 repeatedly, that it becomes a habit and ultimately becomes an addiction, you see sometimes their mental development is affected by that in the long term. We also know that besides specific traumatic stress, we do have something called PTSD, post-traumatic stress disorder, and we see here, and this is quite a kind of harsh reality. It says here 30% of drug addicts and 15% of alcoholics have suffered some form of PTSD. So we find these numbers certainly would agree with some of those videos that we showed in the introduction, where we look at those soldiers in the Vietnam War potentially turning to drugs and alcohol. Now, of course, before we kind of move on, it's this idea that exposure to the trauma is not the only thing that leads us to addiction. I'm hoping that you're seeing with risk factors that there may well be a number of risk factors, and certainly experience. If I live in a particular household where maybe alcohol and drugs are not kind of used or kind of not part of kind of everyday existence, or we have a good support network, I can experience trauma and kind of be able to come through it with the right type of familiar support. But of course, if I turn to my friends and they lead me into a situation where potentially I kind of try different substances and I kind of see the effect on me, then of course that's going to be kind of more kind of serious than others. Now, of course, what we do need to have is that specific understanding of everyday stress and traumatic stress. But both of those lead into an actual model that comes out of the risk factor of stress, and that's called the self-medication model. Now, this is actually something I quite appreciate, and as such, I think it's quite good. Now, some of the books that I read do tend to say we need to move beyond the self-medication model, but just in terms of a basic understanding, I think it's quite good. So what it says here is that individuals intentionally use the pathological behavior. Intentionally use. Okay? So the pathological behavior, as I said, is drinking alcohol, taking drugs, turning to pathological gambling in some ways. Now, they do that, and the key here is treat. Okay? Now, all of us are actually familiar with this idea of self-medication. If you perhaps are feeling really tired, maybe you've got a massive headache, you might then choose to treat your headache with taking some paracetamol, or you might go and lie down and get a hot water bottle or something along those lines. Okay, so these are all things that we do without having any actual medication, so medical training, in order to help us feel better. So it says we do this to treat the symptoms. Okay. Now, of course, we might have some good evidence that taking paracetamol or taking ibuprofen does actually take away our headaches or our cramps or whatever it is that we have. Okay, so therefore there is some medical evidence that those things may well work. But relating to addiction, we can have the same type of thing. If I'm trying to forget the trauma or perhaps deal with the loss, whatever it could be, I could turn to alcohol to treat that symptom. And after 6 or 7 pints, I can't remember my troubles, or those troubles may be numbed. So therefore, that's why I feel it does kind of make a lot of really good sense. Now, it's called the self-medication model, and what is kind of more detailed about it, it says the choice of the pathological behavior is not random. So, for example, if you did have a headache, you just don't go to your medicine cabinet or wherever you keep your parents may keep their medication and take anything that is in there. You look specifically for something that you think will treat the particular behavior. So the same thing here. I choose my addictive behavior in order to kind of fix what it is that I want. So it says here, it's perceived to help. Now, of course, that word perception or perceived is actually quite important, because what it means is that we could have different perceptions. So for me, I could drink myself silly in order to kind of deal with the trauma in my life. For you, you actually may work hard and achieve and get straight A's and go to the top university or whatever it could be. Different kind of like motivations and cognitions and thoughts can go into this. Now, of course, we also just need to remind ourselves that certain kind of substances are kind of a quick fix, aren't they? If I drink too much alcohol, I will have a specific effect of alcohol. If I smoke cannabis, or if I take cocaine or any of those such things, it's going to have a specific kind of effect on me. Now, once again, adding to this, I say here, the self-medicating person does not set out to become an addict. Okay, they take it to make them feel better. It should be feel, not fee. Okay, there we go. The treatment focuses on the effects of the behavior. So it's kind of something like this. If I'm feeling unhappy and I've been introduced to maybe a drug that makes me feel happy, I might then medicate with that particular drug. Now, of course, it goes back to this whole reward mechanism. The more likely it does the thing that I want it to do, the more likely I might want to re-engage with the behavior. Now, this is an example I decided to use because I've kind of used the analogy with actual drugs, but it can also be about kind of behavior like gambling. So it's not always direct cause and effect. So I might not gamble just because I'm feeling poor and I want some more money. I might gamble because I feel depressed. Now, of course, I may well be feeling depressed or sad because of the poverty, because of the financial constraints I have in my life. Okay, so then I gamble to help me overcome that depression. Now, it could be that gambling is actually fun and that I enjoy it and it stimulates me. So therefore, it's actually doing what it's meant to do. It's making me feel better. Okay, so it says gambling might not actually make things better, but is judged by the individual to make things better. Judged by the individual to make things better. Now that's really important here. Okay, and probably why it becomes quite challenging to fight addiction, because I might just find that actually it's just so much easier to drink myself into oblivion than to actually deal with the trauma that I have. Now, of course, the point of these risk factors is that we need to be able to describe them and how they make a person more or less likely to become an addict. Though there is a likelihood that you could get an essay or certainly an applied question that requires you to evaluate. And so I have once again put a number of evaluation points for this particular risk factor. Now, there actually does seem to be quite a lot of evidence for self-medication, and certainly when it comes to gambling addiction. This particular evidence is quite interesting because Lee was able to find some gamblers who gambled for pleasure, okay, and some gamblers who potentially in the interview said that they do it to escape, okay. Now, you might find, well, surely if I gamble for pleasure, I might gamble repeatedly and things like that. Now, I've worked in a race course, and actually there are some people who gamble every single week because they own horses, because of the job they do, things like that. So it could just be that some people enjoy gambling. However, he was able to differentiate these two groups, okay? But this is the key here. It says those who gambled to escape, okay, were more likely to have other substance dependencies. Now, why is this self-medication? Well, it's quite straightforward. It's because if they were getting everything they needed out of gambling, they wouldn't need other substitute means to do that. Okay, so in other words, if I was getting everything I could from gambling, I wouldn't need to drink or take drugs. However, they said that those people trying to escape needed more than just gambling. So gambling was just one aspect of the addictive kind of issues that they had. It was, and this is the situation that I've found, is that there are certainly people who are using gambling and drinking and stuff like that as combination just to kind of deal with their everyday trauma. But we do need to remind ourselves that it is all correlational, and the biggest problem with self-medication, the biggest problem with kind of relating stress, is that it can't show cause and effect. Now, this is quite important here, and it doesn't mean that stress is not a risk factor. It just means that we need to be careful about what we think about stress as being the risk factor. So it says here, self-medication model would argue that some form of psychological distress must come before the addictive behavior. So in other words, I am stressed, I then turn to the addictive behavior. Okay, now why is this an issue? Well, we see something like this. So Bacona, back in 1996, did some research on pathological gamblers and found that a number of them, or a significant number of them, had major depressive disorders. So we might be tempted to say, well, actually, the depression caused them to turn to gambling. Okay. However, this is not true. It could be that the depression is because of the gambling. Certainly, I would say if I was losing my home, perhaps my marriage had broken down, perhaps my other relationships weren't kind of quite working, I might well end up being depressed. Okay, you can see how we need to separate the two. So if it was purely self-medication, we would have the psychological problem, would do the addictive behavior, and that would be that. But we find that actually sometimes it's really difficult to tell which comes first and not. And certainly, if you did take a chance to watch the film Leaving for Las Vegas, there is kind of a really horrible horrible and a depressing scene where the person says, I can't remember if I drink because my wife left me, or my wife left me because I drink. And that's kind of an unfortunate reality of addiction. Now, so just to kind of move towards the end of this particular video, I just wanted to just point out to you that actually there is little evidence that addictions decrease stress. So because if you look at something, I know this is not cognitive, but if you look at that kind of the vicious circle, clearly if I'm short of money and then I'm gambling to make up money and losing money, and it becomes a bit of a vicious circle. But for example, a lot of smokers said they smoke in order to reduce stress. But we actually find that it increases stress. So if we, put the biometric readers on them, we see that that as a smoker, that they're literally more stressed as a smoker than they were before they were a smoker. So what this is highlighting is that there may actually be other factors that could explain addiction. Okay, and for me, it kind of is interesting that it could have the psychological effect. And I always like to kind of end with this idea that Hayek actually said that if I am actually a smoker, what happens is I have stress about smoking my next cigarette. Okay, so my actual overall stress levels are higher, but when I actually do get a cigarette, it's stress reducing. So it's a kind of psychological effect of that. Now, that's may be confusing to you. I hope it isn't. But I just wanted to point out that, look, we don't feel that addiction does do the job that it's supposed to do. Okay, often causes more problems, but we could also understand that the reason it may well be compelling is because it kind of does do something. Let me go back to that analogy. I'm actually feeling quite stressed, or I'm feeling depressed, or I'm trying to mask the pain. I drink alcohol. It does just that. It masks the pain for those couple of hours, those couple of days. Okay, and of course that reinforces the particular behaviour, and so of course it's easier to go back to it. What obviously I'm hoping that some of you are thinking is that what we really need is to kind of have therapies or some kind of way of looking into a person who's an addict and trying to find out, well, what is it? What is the cause of their addiction? It is unfortunate that we can quite strongly say is that somebody who does have stress is likely to be more vulnerable, and therefore stress is seen as a risk factor. Now, I hope this has been interesting, and I will continue on with this series as best as I can. I hope you have a good day and that everything is going well. Please do keep in contact with us. Tell us how it's going. Even if it's not going well, please just tell us so we can kind of know that you're not just ignoring us and not doing the work and things like that. It's not about the work, it's about you. Okay, so please take care, and I'm going to end there. Okay, bye.